All right. So now we're to the demo component of our episode 36, how to find the best hospice agency. And you may have your little ditto sheet ready, or you may have already, got some teenagers or a neighbor or someone to help you with the computer. I forgot to mention that. I know everyone is not savvy with the computer, but we want to make sure that you're able to, get the information you need to, do what you need to do to make the best decision for your family. So let's go ahead and look at these 5 simple steps to find and choose the best hospice. And Nurse Gerard is going to guide me through the process. So, which zip code are we going to pick?
All right. So just to point out, you went to Medicare.gov and find and compare providers. And scrolling down, you can see on the left side of the screen that you've chosen hospice. And so, yeah, put in the zip code 75052.
Where is that?
That's Dallas.
750.
52.
Now, Dallas, we're just using you for demonstration purposes only since we mentioned you during the podcast. I don't want any hospice agencies coming after me. All right. So let's search Grand Prairie, Texas.
Yep.
Great old state of Texas. So there we go. We have, let's see, 95 results.
Yeah, so the first 15 of 95. All right, and just kind of scroll down just to kind of like take a quick look at what's showing up here. Okay, you could stop and just, all right, so we've got a little bit of identifying information. Wow, we've got a 4-star here. Okay, let's go back up to the top.
Mm-hmm.
And you see where it says filter by?
Yes.
Okay, filter by ownership. Let's start there. We're going to first start by what are our not-for-profits. So click nonprofit.
And apply.
Yeah.
So now we're down to 5. That's good.
Right. We went from 90 plus to 5. And let's just take a quick look at what our options are. We've got Community Hospice of Texas. Okay, 3 stars. Not available.
What does that mean when it's not available? Does it mean that's a baby hospice?
Float over the footnote.
Oh.
15. Yeah. It's going to, yeah. Number of cases is too small. So for star ratings, I learned that the star ratings are based on 8 calendar quarters or 2 years of data. And it has to be at least 75 surveys returned. So not enough indicates probably a pretty small agency with a very low rate of surveys returned. Okay, but we got
3 stars.
Yeah, 3.
Oh, 5 stars. Look
Okay.
at that.
Okay, here's what we're going to do. Oh, all right. Tell you what, pick the 5-star, click on the button that says compare.
Okay.
Right under the stars, right?
Oh,
okay.
And everyone see how it goes up to the top blue box. There you go.
Yep. Scroll up the list and grab 2 more, Faith Presbyterian and Community. Yeah, grab Community, the same thing. Click on
those
compare.
are 2. Could those be 2 branches of the same one? That's the exact same name. See that? Yeah. Community Hospice of Texas, maybe 2 different locations.
Probably. Could be. Yeah. Worth checking out. We're going to check out the one with 3 stars. We'll click on compare for that.
Okay.
And then scroll down and grab, say, Faith Presbyterian or the VNA.
Let's do a VNA. I think I heard about that one. Let's see.
Okay.
Around here.
And
all right.
So
and now what?
Compare 3. All right. And then it's under where you put my head.
Okay. Compare. There's a compare button. There we go.
Click on the compare.
So now we're done with step 1.
Yeah.
And we're on to step 2 now.
Yeah. We went from 90 plus to 5. And from 5, we took 3. And now let's just kind of look at these guys side by side. Scroll down a little bit. We're going to look at the Medicare certification date. Do you see that one?
Yes.
Okay. Bring that up so it's right under each. I just keep scrolling. So it's, yeah, okay, just so we can keep an eye on it. Because we're going to look at that. We're going to look at census. So going from Hospice of East Texas, they were first certified by Medicare, certified as being capable of billing Medicare back in '89, Community back in '84, and the other one in '84. So they've all been in business in hospice for quite some time, which is good. Average daily census. So this is a rough estimation of kind of like how big they are. And this is certainly something that you'd want to double check in talking to an agency. This data may not be up to date. They may be bigger or smaller, but I mean, it's actually interesting. We've got kind of a small, medium, and large. East Texas, 214, 170, and okay, so they're roughly equivalent. 314 is definitely a bigger challenge than 172. All right, so we'll kind of like keep that in mind, small, medium, and large. Let's take a look at conditions treated.
Okay.
Scroll down.
So now we're on the characteristics, listeners, what the characteristics are of the agency. So these are the conditions.
The medical conditions that they treat. And this could be helpful if, for example, we're specifically looking for an agency that is skilled at a particular disease state, heart disease or dementia. We can also see if a hospice is skewed one way or the other. These are very broad categories, but the cancer comparisons are roughly the same. Dementia, VNA has twice as many as the others. The other difference too is that someone on hospice for dementia may have a longer course as opposed to someone with, say, an aggressive cancer, which has a steeper rate of decline. But that's just rough. Okay, so we're looking at those. If we scroll down to the next kind of category.
I have a question here. I have a question here just for the listeners who may have the Real Deal About Hospice book. Our first chapter is ALS, and they don't seem to have a neurologic disease, category here. So I'm wondering if they put that under other conditions or if they put it under stroke. Just curious about that.
It's very vague, and clearly that's a medical condition that if you're couple things, a family who's been dealing with ALS has probably been dealing with it for a while, and they're probably competent themselves around the care. So they're going to have high expectations, and the agency needs to be prepared to deal specifically with the clinical challenges of ALS, having to do, say, with breathing and aspiration. So yeah, and that's not specifically identified here. So that's definitely one to have a conversation about.
Absolutely.
And even one to really like make top of the list. Have you ever had patients on service with this condition, and how? Because that's
right.
That's a
and
good
if
one.
They're collaborating with, the respiratory therapist, if they're weaning off of their respirator and things of that nature. So those will be questions that you ask, and you want to know ahead of time, people. So you don't want to make that decision, at the last minute. Right. Okay. So now locations of care, that's where we're going next.
Yeah. We'll open up that.
Oh, okay. Remember, hospice goes wherever home is, right? Some people live in a private home. Some people live in an assisted living community. Some people live in a skilled nursing facility. Some people are in the hospital. Some people are in a memory care or long-term care facility. So these are the various locations that they're highlighting here.
Yeah. And they're roughly equivalent from what I can see as far as home. They all have a high a high percentage of patients and families living in their own homes. Assisted living, VNA gets more for those. That can indicate a strong relationship with one or more facilities. Same thing with nursing. I think there's a big difference, I think, in working with a patient and family who live in their own home versus working with someone, say, who's a resident at a long-term care facility. For the resident in the long-term care facility, that's their home. The staff at the facility is their family. The
Mm-hmm.
staff at the facility sees the resident as one of their family. They've likely been there for a long time. And so, say, a hospice nurse or hospice staff that can navigate effectively in that setting where you're working with a team that knows the patient better than you for a
Mm-hmm.
longer period of time than you, and you're advising them, you're not taking over. Um, or it's just a different environment to work. And I can tell you, I was never really all that good working in those settings. It just wasn't the setting for me. I worked better directly in the home, and vice versa. I had colleagues who were magnificent in facility type settings, not just because they knew how to work with staff, but they knew how to work with staff to get something for the patient.
Yeah, that's good to
Resident.
know because I've had, nurse colleagues on the interdisciplinary team. They have this one particular one where the communities love this nurse. And so again, those are the type of things that are important to look at for this care. All
They could be
right.
sources, and they could be sources. I point them out because they could be sources of conflict, and they could be sources
Mm.
of conflict that impact the care.
Oh, wow. Okay. Okay, so now the next section is the level of care provided. Now there's 4 levels of hospice care. Let's review.
Yeah, this
Um,
one I find not all that helpful because while Medicare certified hospices are required to provide all 4 levels of care, this just talks about this just rates, okay, do they provide the routine level of care and one other? So it's kind of like
mm,
a weird,
yeah.
unhelpful thing.
And to review, listeners, the 4 levels of hospice care is routine home care. Most
Yeah,
folks who are at home are on that. The next level is continuous home care. That's to take care of a patient during a crisis and to keep them at home. So there'll be 8 hours of primarily nursing care in 24-hour periods. Go back and review that during the regulatory episode. Then there's general inpatient for those folks who are in the hospital. Maybe they started in the hospital because there was a catastrophic situation of a code or a stroke, and there's a compassionate extubation, or maybe they were at home. They have um, they have cancer, they have cholangiocarcinoma, their pleuric drain is no longer working, and now their symptoms can't be managed at home, and they were moved to an inpatient unit. That's general inpatient. And then the 4th level is respite. Respite is allowed during the benefit period up to 5 days to help the caregivers, right? You need a break. And we
break.
know people get guilty and they don't want to take breaks, but a part of the hospice Medicare benefit is for you to have respite. And typically the patient goes to a skilled nursing facility or someplace where the agency has a relationship, and you don't have to use all 5 days. You can use 2 days. I've seen it, but people people benefit from it, and it helps with caregiver fatigue and burnout and all that stuff. So anyway, that's that.
No, that's important. Um,
Next section.
the next one is the family caregiver experience.
Okay.
The Medicare reporting requirements for hospice is not another not helpful one, but let's see. Yeah, so this is kind of where the rubber meets the road here.
Mm,
We're going to start comparing these kind of side by side. Um, so overall, we've got a 5-star, and I got to tell you, I haven't. This is the first 5-star agency I've brought up.
really? And
Yeah,
look, people, when it says communication in all the categories, you see where it says national average and Texas average. That's good to take into account because then that kind of qualifies what that number is for you. So that 5-star agency, they're above average. Wait,
Oh
actually, all
yeah.
of them,
Oh
except
yeah.
for, that last one, they're 1% below the Texas average.
Communication with family is important. Here they're looking at, um, did you get consistent information? Did you get your questions answered? Um, and these numbers, what the 85% means is that 85% of the surveys returned for this time period rated this agency either a 9 or a 10 out of 10. They rated them at the top of the scale, for communicating with the family. Um, so yeah, that's really good, a really good score.
Mhm. Let's see, now
Timely
we
help,
have, that's
yeah,
important.
absolutely. Timely help is one, where you've got some pressure, particularly off hours. The survey questions here have to do with how did you need help on the weekend? Did you need help in the evening? Um, and so again, Hospice of East Texas is earning its 5 stars. Community hospice is coming in, just above the average, and VNA is falling short on timely
Hmm,
help. Um,
interesting.
the implication being, well, yeah, you could take any of these apart. What we're really looking for is like the outliers. Um, and Hospice of East Texas is an outlier on the positive side with this thing.
That's good. And let's see, we have treating with respect. Again, that's a, subjective thing. Do the person feel like they, you know, got what they needed and they were addressed appropriately? And a lot of times families, they come to us after they've gone through the ringer in the healthcare system. So there's a lot to repair. Um, I find in my initial visits, in our initial comprehensive assessment, there's a lot of problems we're unraveling and psychosocial issues. So if we don't have enough time to get to them, sometimes that can be a problem. But if we have enough time with the team, then we're with the families, then we're typically able to, get everything right.
And think about it too. Treating patient with respect. For me as a nurse, there was a big difference between working in a hospital setting and seeing people in their own homes. So how is the team as a guest? Coming into your home. I
Yeah.
mean, in a way, I think treating patients with respect. I mean, that's a gimme. Everybody should be getting 99 on this. Um,
Yeah.
so.
Yeah, but sometimes, I mean, I'm not making any excuses, but sometimes the things carry over from the whole
Oh
past
yeah.
2 months that they've been through. And, so again, that's why we want you all to be able to make these decisions timely. So now we have, let's see, emotional and spiritual support. We have our chaplains and our social workers that help.
Yep.
So it looks like everyone is at the national average there and above the Texas average. Here's where the nitty gritty is: help for pain and symptoms.
Oh,
That's why we're there, right?
I do want to point out something. If you go back to the one before, yeah, emotional and spiritual support. The metric here is the right amount. Did you get the right amount? And if you think about it, if there is a family for whom their spirituality and their religious identity is really central to them, then it would be appropriate for the hospice team to match that in some way, or at least to be aware of the role that plays in their life, and to act accordingly. And so, what the right amount is for that family, and what that family would consider to be the right amount, would be different from another family who looked at things very, very differently. Um, and how did they feel? Did they get the right amount? And I think this reflects, like, okay, how knowledgeable and skillful and adaptable and sensitive to the needs is the team.
That's good, because the chaplains are not there to proselytize. They're
Exactly.
required by, the conditions of participation to provide bereavement and spiritual care and support. in a manner that's relevant for the patient and family. I don't have the exact words, but
Yep.
it's not what we want to give you. It is patient and family centered. So thanks for pointing that out.
Yep.
So the pain and symptoms, that's why you're on hospice, right? For
Yeah.
palliation of those symptoms and symptom focused care. So looks like they're above average.
This is another one of those pressure. I'm sorry to. This is another one of those pressure ones, like timely help. Help
Mm-hmm.
for pain and symptoms, particularly again in off hours. You can see that the national averages are low. They're down in the 70s because this is a hard one to satisfy. Um,
Hmm.
and looking at the VNA score of 69, that affected them. Community comes in just above average, and Hospice of East Texas, 81 for help with pain
Mm-hmm.
and symptoms. Again, if you think of the context, um,
Yeah, yeah.
this is
And let's
also
see, training family to care for the patient. That's why we're there for education. We're almost to the end there. You want to comment on your role as an RN case manager and how you empower the family? Because some people think hospice care means the hospice team is going to be there 24 hours a day, and that's
yeah,
not the case.
no.
So, you want to comment on training the family for the care?
Oh yeah, no, that's critical. I mean, a trained caregiver, a capable caregiver, is kind of like a prerequisite for successful hospice. As a hospice nurse, I went around running nursing schools, pop-up nursing schools, kind of from home to home. So another high pressure and key task. And again, Hospice of East Texas at 84%. That's really quite high. All
Nice.
three of them do okay there. Nobody really fell far short.
Mm-hmm. Mm-hmm.
But
Mm-hmm.
that's definitely an important one. The next one, rating the hospice. Um, so these are the people. These are the ones that it's like, okay, rated 9 or 10, um, and East Texas just is nailing it. I feel like I'm at a
Yeah.
football game.
They're at they're getting the A plus. And then the last thing, willing to recommend this hospice. This is the word of mouth. This is the
Yeah,
reputation. This is when we know someone has had a good hospice experience and the patient has had a good death and the family is having, appropriate grief, not appropriate, but, not
feeling
complicated
supported.
grief because they were able to you know, have the
Yeah, feel
appropriate
supported.
care. It feels good for us because that's what we do this for. So
Yeah.
looks like again, your East Texas one is above average, above the national average, above the Texas average, and
And
so is the
this one is very telling. The difference between Hospice of East Texas and VNA is the difference between 92% of the survey respondents saying, "Yeah, I'd recommend this after all we've been through," versus 79% saying, "Well, now that it's all over with, I." Um, and this is kind of like, okay, I need to check this out when I talk to them. But this is where this could be helpful in
good.
kind of making a decision. If it came down to these two, um, something like that would definitely tilt me one way.
Yeah. And then right here, let's see, it says
Oh
there's the
yes,
timestamp you mentioned, the December 20th, 2023 was the last
that's pretty recent. Yeah.
time. Yeah. And wait, here's a section about the quality of patient care. This is super
Yes.
important using the
Just the
quality
second one.
measures.
Well, I'm sorry.
Go ahead.
No, no, no. Go ahead. I interrupted you.
No. The hospice item set, that's a quality measure that's important where they have to you know if they do all those things and that they're supposed to check off as a part of the quality measures, again, that's getting kind of deep in there, but I think we've done a good
This
job of
this
helping people see it.
let's go to the second one under quality of patient care. Um, Not the item set, but the next one. This I
Mm-hmm.
think is helpful. The percentage of patients who received visits from a registered nurse or a social worker on at least two of the final 3 days of life. And this is based on like some billing data and stuff too. So, you know, the national averages are pretty low, that like less than half of the patients are getting these visits in their final days. And this is when it's all coming together. So I would expect the hospice team, I would expect higher numbers, because I would expect the hospice team to be on top of things so that when people are in their final days, someone is making an appearance and supporting the family. So
Yeah.
East Texas is doing the best job. Actually, they're all kind of in the same area. But I'll be honest with you, I've worked at an agency where this was 90% plus consistently.
Oh, yeah. Yeah, I did too, because we made it a point to have a Tiger text thread of when our patients were looking like they were imminent. And so we would just jump on those visits. What this is called is HV Little, or the hospice visits on the last days of life. And that's a real important quality measure. And why is it there? Because that's when you need the most support. That's when the symptoms may be changing rapidly. And so the social worker, which is, you know, an MVP, a core member of the team, and the nurses there, that's just showing that we're addressing the family need. They don't even have the doctor on there. So what does that say to you? But
Well,
this
it's
particular
good.
hospice
It's good.
agency I was
It's
with, I also went as
yeah,
well.
yeah, yeah,
Again,
yeah,
so the family felt like we were on top of their care. And
yeah.
so that's what's here. And so we got through two steps, 1, 2, and 3. And now finally you go to their website. I'm sorry. The third step is going to their website. So we would check out
Mhm.
the social media of Hospice of East Texas and Community Hospice of Texas, see what they have out there, see how it feels, set up that visit, and then pick one of them. And I think from these, we may have a good experience. You think?
Well, you know, this was a good exercise. I've never really looked at these three before. I think I've come across the VNA in another search, but um, you know, there's certainly all three options are viable. They're all 3 stars. They've all been in business for a while. Um, None of them really kind of like fall off the table at this point. I think they're all worth talking to. I would go into talking with them myself with some kind of assumptions already,
Mm-hmm.
but this actually, if I was starting from scratch and this is what I had to work with at the start, this would be okay to start with. Absolutely.
That's good. Well, we are so grateful again to have this opportunity to demonstrate this to you. Feel free to comment in the YouTube video and the podcast app, wherever you want to reach out to us with any questions. Again, there'll be a handout available on the Morning Dove Medical website, and we wish you the best with finding a hospice agency. Thank you.
All right.